Ladies and gentlemen, thank you for joining us for this, the second day of the G20 Interfaith Forum 2020. On behalf of the KAICIID team here in Vienna, Austria, and all of our partner organizations, the G20 Forum Association, the United Nations Alliance of Civilizations, and the National Committee for Interfaith and Intercultural Dialogue in the Kingdom of Saudi Arabia, welcome. The G20 Interfaith Forum harnesses the vital roles that religious institutions and beliefs play in world affairs, reflecting their rich diversity of institutions, ideas, and values, and bringing them together in partnership with policymakers. We do this by bringing recommendations and policy outputs to the G20 process, which is an annual gathering of world leaders. The G20 summit this year will be hosted by the Kingdom of Saudi Arabia, one of KAICIID's founding members. For those joining us today for the first time, I would like to take this time to introduce you to the virtual environment that we are gathering in and to some of its functions. I'd also like to remind you that you can always watch the recordings of the previous day on our YouTube channel in case you'd like to catch up. In the bottom left corner of your screen, you will find supporting documents for the panel discussions, such as recommendations from the 6 regional consultations that have preceded this meeting and policy briefs that have been compiled in the previous months. In the bottom right corner, there's an opportunity to exchange during the session itself. If you'd like to ask a question or post a comment, please put those in the chat function. We'd also love to learn more about the participants in our forum, so we invite you to use this function to introduce yourself with your organization and your country of residence if you'd like to do. I should remind you that the chat is meant to be a safe space to connect with other users and to ask questions to panelists. So I'd ask you to please remain respectful and dialogical in the chat. Offensive and abusive language will be removed by our moderators. For interpretation from Arabic to English or English to Arabic, please click the language symbol on the top right of your screen. It will also be interpreted in Spanish, so please follow the instructions provided on the website you're using. It is my pleasure to begin today by handing over to our keynote speaker. We are privileged to have with us today His Excellency Hassan Nadhim, Minister of Culture, Tourism and Antiquities in Iraq. Your Excellency.
It's a great forum. Thanks for KAICIID for the invitation.
إنني أشكر
Please allow me to present views in Arabic. فرضت أزمة كوفيد-19 أوضاعاً استثنائية.
COVID-19 created a new situation in the world. It led to quarantine, it led to lockdowns, which had great impact on institutions, on economics and the social lives. We heard many recommendations from international organizations. This pandemic had many impacts, not only on the economical life, but also on politics, which we still find in the social and cultural life of people around the world. People were not able to look after their interests. Economics broke down. Of course, Iraq was also very much affected. Governmental institutions had to look into solutions and try to find measures in order to deal with the pandemic and in order also to deal with its impact on the peoples in Iraq. Apart from taking up measures to move forward to find a strategy, a new strategy, and new working plans and new development programs for the future in order to help states to deal with such challenges in the future, especially in Iraq. We were part of the states which suffered from the crisis much more than other countries. The pandemic COVID-19 came to us, and in spite of the many negative impacts of this COVID-19 pandemic, we are lucky that great cooperation and coordination between governmental institutions and organizations led to being able to deal with the impacts and of the COVID-19 pandemic, not only in the health sector, but also to be able to monitor the daily infections, the daily cases, and also take up measures in order to raise awareness through media to meet the threats, to meet the dangers, not only through the media, but also through social channels, working together with institutions of different kinds. But let me here stress the role, the very important role, and the sacrifices brought to us from the health sector, this army in white, as I call them, who suffered, who provided all the efforts and endeavors in order to win the battle against this pandemic. Apart from the human role these persons in white played, also government institutions, religious institutions, organizations, NGOs work together in order to be able to deal with the impact, in order to find recovery, in order to provide relief for the suffering, not only for those who were infected, but also for those who lost their jobs, for instance. They were given help and assistance in order to be able to deal with this new situation. The government of Iraq, however, did not only take up measures in order to deal with COVID-19 on the health basis, but also reached out to the cultural institutions in order to crystallize a set of measures by coordinating between different relevant institutions and taking up measures and responsibilities in order to be able to live this very special situation, not only in Iraq, but in the region. As you know, as we all know, culture is one of the major sources for the livelihood of people. Culture is one of the major rights of citizens, may it be in peaceful times or also in the times of crisis and catastrophes. Satellite channels and social media were very important platforms in order to raise awareness, in order to spread new ideas, in order to spread programs and cultural seminars, which assisted in fostering the coordination and communication between people around the world in order to help people deal with this very new situation. Here we need to point out the very important role of religious institutions and also of religious references, of religious leaders, who, all of them, provided very special support to raise awareness amongst the people, amongst public opinion, but also raising the awareness within governmental institutions after
جائحة كورونا
government, after the government in Iraq
بسبب الرفض الشعبي
having some problems at the beginning of the COVID-19 pandemic, when people refused to agree on a lockdown or refused to agree and abide by quarantine. Here we being the government reached out to religious institutions in order to find their help and support, and in fact, they supported us in putting mosques and churches as well as all worshipping places under quarantine. These institutions succeeded in spreading quarantine and spreading lockdown. This was a support and a fostering for the role of religious leaders who help in crisis and to help and assist people when living in crisis. Here, we also need to point out and stress the very important role of the media, of course, the role of media when helping dealing with such pandemic which come along without further notice. Please let me finalize my short intervention also by pointing out the impact such a pandemic and such a crisis has on governmental institutions. May peace be upon you, and thank you very much.
Thank you, Your Excellency. As Your Excellency pointed out, the COVID-19 pandemic has reshaped our world in so many ways, from the societal to the personal. It's also the reason that we meet here today virtually and not in person. It's my pleasure to welcome the moderator of our plenary session to discuss this issue in more detail, Ms. Kirsten Muth, CEO of the Joint Learning Initiatives on Faith and Local Communities.
Greetings, and thank you, Your Excellency, for your opening comments. I would like to thank the conference organizers who have brought us together, particularly the Interfaith Association, the KAICIID Dialogue Center, the United Nations Alliance of Civilizations, and the National Committee for Interreligious and Intercultural Dialogue in the Kingdom of Saudi Arabia. Religion affects how we understand life and death, what we strive to achieve in our work and lives, and how we understand health and development. In this time of COVID, understanding how we interpret the events happening around us through the lens of religion is more important than ever. Faith actors have led responses to adapt and innovate, both within worship practices, as well as addressing the gaps widened by the structural inequalities COVID has so starkly highlighted, including food security, healthcare, violence against women, childcare, and education. Faith actors have stepped in and overcome barriers to fill numerous and diverse social protection and support gaps, and expanded these efforts in the face of the pandemic. Along with other community-based efforts, they are often the first and last responders, serving communities before larger-scale responses arrive and sustaining support long after others have left. Many faith actors quickly adapted existing programs by pivoting to online methods, localizing responses, and working with strong established faith networks around the world. They built on their experience with previous epidemics such as Ebola and HIV, immediately demonstrating that they are critical partners. Our faith actors have also seen challenges. Many have not been able to continue to provide for some of the most vulnerable in the ways they would want. In our own joint learning initiative on faith and local communities and Christian Connections and International Health Survey, 88% of our responding organizations reported that they were under strain to maintain their routine programs in the face of the need to respond to COVID-19. Mental health and trauma issues are now recognized as crucial aspects of the crisis, even as faith communities continue to play important roles in pastoral care and counseling. Going forward, these actors will need to build or maintain robust mental health responses. Online and other remote worship has been a fundamental shift for religions around the world, and digital divides mean that some have experienced more isolation than others. We do not yet know how this will affect the social networks and social capital of religious communities. In a pandemic, public health measures should be the center of our attention. Public health messaging with religious leaders is one important link among others in the complex causal chain through which people change attitudes and adopt altered practices. Working with groups outside of formal religious leadership, such as women's and youth networks, has yielded important benefits, especially in traditionally patriarchal religious structures. Public health guidance and regulations on mass gatherings and other religious practices have largely been followed by religious communities. However, some have contested these regulations or perpetuated incorrect health information, discrimination, and stigmatization. Such actions provoke tensions that have at times frayed relationships between government authorities and religious communities and damaged public perceptions of religion. As we move into wider testing and vaccination rollout, faith actors need to be at the table, advising on the intersection of public health guidelines and religions. Their grassroots connections and contextual knowledge is of vital importance to the tricky social and behavioral questions that emerge with vaccine hesitancy and other public health issues critical in the pandemic response. We are very fortunate to have a panel of distinguished leaders who will be speaking to the COVID pandemic and the role of religious and faith actors in responding to this global crisis. We will hear from 6 panelists today, and their full bios will be available in the chat box. Please write your questions in the chat box for discussion after the presentation. I would like now to introduce our first speaker, Dr. Mohammed Al-Abdullali, who is the Assistant Minister of Health and spokesperson of the Saudi Ministry of Health.
Thank you very much, and thanks for the organizers. And this is really an honor for me to participate in this forum. I don't know if my dear colleagues and friends who are at the other end managing these slides, if they can start sharing the slides. In this COVID-19 pandemic, let's look back a few months ago and let's look into the future. So in the first slide, you will see that on your upper left part of the slide, the curve is showing that internationally, around the world, the whole globe is still experiencing a rise in the curve. And still the curve is increasing, and the trend is at its peak and its highest level. We don't know if a higher level is going to be in front of us or no, hopefully not. But still, we are reporting and recording on daily basis multiple and high number of cases. In the Kingdom of Saudi Arabia, you may notice that in Saudi Arabia, the trend is down, and we are experiencing curve that is going downward, which is a positive thing. You go to the left lower quarter of the slide, you will see the G20 countries with different trends. Most of countries are experiencing active spread and transmission of the virus at the moment. A few countries are experiencing downward trending. If you go to the right part of the slide, you will see in the lower section of it that in general around the world there are variabilities. Some countries are experiencing negative growth, less growth from week to week. If the Kingdom of Saudi Arabia, we are experiencing 17% decrease week to week in the recent few weeks, which is something positive. There are many other countries with the blue graduated color, while still there are many countries experiencing growth from one week to another. So in short, still the world is experiencing active disease, and the activity is there all over the world, in every continent of the world. So all humans are experiencing still this pandemic and need to deal with it for a long period of time. We'll go to the next slide. You will see that it's very important for any country to monitor not only the current status, but also to use deeply the available data, use many KPIs and predictors, and do some simulation, and do lots and adopt lots of triggers to proactively act to the disease. As you can see here, just one example of one of the dashboards that we are using among other many dashboards in Saudi Arabia to predict and check what are the signals and what kind of signals we can notice in any of the regions. So we monitor at regional levels, city levels, and sometimes even smaller to know if there are any risks and proactively interact by increasing awareness, doing some restrictions or whatever to prevent this virus from being transmitted fastly among the people. As you can see, the trends are at the moment in Saudi Arabia are, alhamdulillah, in good trends yet. The world is experiencing multiple waves. There are countries registering and reporting new waves and new trends of increment, and that's why all around the world, everyone need to be cautious and need to be alert to detect any increment or any change in the trends of the curves to proactively prevent any further wave. Next slide, please. You will see that it's very important also to work collaboratively with at multiple levels. National levels are very important. We are proud here in the kingdom to have a Saudi Food and Drug Administration, FDA, and Saudi CDC. All are participating effectively in the prevention of the disease, but it's very important also to mention that there are national health command centers, national CCC, which is the center responsible for handling outbreaks. There are emergency and preparedness and health disaster management systems and centers, all working hand in hand with different scope, different level, different management. And it's very important to mention that their experience, particularly the CCC, the National Command and Control Center for Outbreaks, is having good cumulative experience since they handled the MERS-CoV, the Middle East respiratory syndrome, which is another coronavirus. And successfully they were capable of handling it in the kingdom and participated also globally in the prevention of the spread. That this cumulative knowledge with all other centers is helpful in managing data, admissions, ambulances, referrals, laboratory testings, artificial intelligence, the elements of digital system utilization, healthcare intelligence and epidemiological investigations, name it. All of it, they are responsible to manage it, to see all these services at national level managed and controlled appropriately. In the next slide, you will see that all these services are provided to everyone in the community. No discrimination. All regions, citizens, all residents, regardless of their status, even those who are breaching the rules and regulations and staying against rules and regulations in the country are dealt with fairness in comparison to all other, same access to care, same way of management. So it's all these services are covering all community members, all people in the kingdom, handling this pandemic and serving them to avoid any harm that may happen to them because of this pandemic state. Alhamdulillah, the kingdom now is 13th in the global ranking for the country's safety in terms of handling COVID-19, and this is by scoring more than 700 points, which is only few countries are capable of attaining. And also from month to another month, we are moving, and the trend is up and improving, and we are gaining more scores. And this will never come without giving access and chance to everyone in the community, free of charge, to access the healthcare. And the next slide, you will see also researches and activities. The outcomes are helping all the community members. If we move, you will see that beside these researches, next slide, please. The healthcare is provided and praised by the Lancet, which is one of the prestigious scientific journals. And in its editorial mentioned that the Kingdom of Saudi Arabia is one unique example where safety is good, the unlimited support to critical care, unlimited support to fever clinics, and digital services, and all of these will never bring good safety to the community without being provided to all the people in the community without any discrimination. So this is a very important thing to keep in mind. If safety of few people is jeopardized, then the whole community health is jeopardized. Next, please. You will see also the policy and testing. In the map, you will see that the dark blue countries are countries providing the test for everyone, symptomatic, asymptomatic, regardless of anything. And here in the kingdom, we provide it for everyone, regardless of their status, just if they are willing to do the test and free of charge. And the amount of availability is also helpful to prevent the spread of the disease. Next, please. Many countries are recording good numbers in terms of mortality rate, and also we are among the best in the ratings of and recording low mortality rates, which is something positive. And these are all outcomes of all these efforts and all of that good access to. Next, please. Now look at the world 10 months or 12 months back, 1 year from now. The whole world is blue. Everything is accessible. No restrictions, no limitations. Schooling, going to social activities, accessing malls, travels, going and visiting holy sites and religious places, doing multiple activities in life with restriction. Next slide, you will see the current status. You will see the world is not anymore the same. There are restrictions in schooling. There are restrictions to go to work. There are multiple countries still advising people to stay home and to avoid gatherings. And there are travel restrictions. So the whole world is changing. And definitely, we will move to the next slide. All these things will change the way we are living. We are adopting more digital, less dependency on going to sites. So remote work, digital and virtual healthcare delivery, virtual schooling and learning. All these things and contactless payment, all these things are happening now. And these are not going to be only things that we are reactively deal with this pandemic, but also may remain decades and centuries in the way of our new normal way of recovering and going back to our life. Next, please. Vaccine is a very important thing. This pandemic will not come to an end most likely without a good immunity. The herd immunity or the natural immunity in the community will not happen without endangering the lives of the population. So we are all hoping, praying, and wishing to see an active, effective, safe vaccine soon, inshallah. It's 7 to 10 vaccines are promising. Hopefully, we'll see something approved and available prior to the end of this year or by the beginning of the coming year. With the presence of that, things may go back and recover appropriately. It's very important to keep in mind that availability of vaccines is nothing unless we make it accessible by all and to everyone, and to produce it in an amount that will be sufficient to cover all those who are in need of it. Next. It's also very important to know that eradication of viral diseases may happen. It's unlikely in the situation of COVID-19 because of the current status and current info. Very important 3 things to be done. It's very important to prevent outbreaks and prevent spread of the disease. Testing, detecting are very important things to prevent that. It's very important also to suppress its transmission and mitigate. Awareness is very important. It's also important to bring it in different languages, different ways that people accept. And it's also important to treat the availability of all treatments, all required beds and care need to be accessed by everyone. All are available, and we are doing in Saudi Arabia, and will continue to do as far as this pandemic is happening. And these are very important things need to be accessible by all people at any time to ensure the safety of the community. Next, please. The humanity experienced multiple sad, tragic stories in the history, and we passed this one successfully. Not only recovered, but we moved from one level to another, from one civilization stage to another. We improved and developed, and we are having the power, the strength, and the willingness, and the excitement to do so, and all the capabilities. Sure, inshallah, will let everyone pass through this tragic event to a better life in future. The next and last slide will show that 100 years back, the Spanish flu, people experienced and passed over that and successfully improved in their health, in their way of life. Now, definitely, better ways of handling this, similar in many countries, pandemic to that one, but we will overcome this one with God's will, and we will be, inshallah, all safe and in better situation. And maybe now we are distantly away from each other, but with hearts unity, we are more than close to each other. Thank you.
Thank you, Dr. Abdulali, for an excellent overview of the pandemic and for the contributions to research that the Kingdom of Saudi Arabia is making, and also for your access and support to care that you're providing in the Kingdom. Was a wonderful presentation. I'd like now to introduce our next speaker, Elder David Bednar, from the Quorum of 12 Apostles of the Church of Jesus Christ of Latter-day Saints. Welcome, Elder Bednar.
Thank you. I'm grateful and honored to participate with you in this G20 Interfaith Forum. In the face of widespread and growing confusion about the essential role religion plays in our personal and communal lives, this interfaith gathering is more important now than ever. We may come from different religious traditions, but we are united in our commitment to promote understanding and true respect for religion and people of faith. Our Saudi Arabian hosts have addressed many priorities, but it is clear that the COVID-19 pandemic has tragically emerged as the unavoidable overarching theme. My aim is to highlight some of the most critical lessons that religious voices have been learning. The ongoing pandemic has demonstrated that some government officials fail to understand how and why religion is fundamental to the lives of billions of people. COVID-19 regulations have often distinguished between essential and non-essential activities, and then treated religious activities as non-essential. This completely misconceives how vital religion is to people's lives. Governments obviously have a crucial role to play in protecting people from the coronavirus, and I applaud the sincere efforts of government officials around the world to do so. As with secular activities, religious activities should be carefully limited when truly necessary to keep people safe. No one has a right to spread a dangerous virus. But that is not the end of the matter. How secular officials understand religion and religious people deeply influences how they treat religious institutions and believers in a time of crisis. The deeper and more respectful the understanding, the more legitimate and effective public policy responses can be. Surely, at least part of the crisis of legitimacy in the response to COVID-19 arises from the failure of some policymakers to account properly for the centrality of faith in the lives of believers. For billions of people around the world, religion is the very center of our lives and the core of our identity. Our faith calls upon us to love God above all else. It defines who and what we are, how we understand the meaning of our lives, and how we live each day. It is the source of our strength, consolation, and hope amidst sorrow, travail, and death. Faith traditions are the incubators and shapers of family and community life, creating and sustaining the spiritual ties that link and bind people together. Religion transmits moral and social truths to the next generation. Can anything be more vital? Our faith is more than just important to our dignity as human beings. It is essential. The centrality of faith to human dignity is why international law holds that basic religious freedom is non-derogable. In other words, it cannot be taken away or forfeited, even in times of emergency. To deny such freedom is to deny something fundamental to a believer's soul. Severing people from their religious communities threatens people's spiritual, mental, emotional, and physical health. Experts are documenting the rise in depression, physical and emotional abuse, suicide, and other tragedies during times of social lockdown and isolation. Some have construed calls for sensitivity to religious freedom during the pandemic as cavalier demands to ignore the risks of COVID-19 or to disregard sound public policy. That is not what responsible voices in the faith community seek. By recognizing religious freedom in a time of COVID-19 and by acknowledging the essential place of religion in people's lives, governments and policy experts can win allies in a common struggle against not only health risks, but other serious risks as well. Strong connections among family, deeply held religious beliefs, and a community of faith have long been associated with better mental, emotional, and physical health. These critical connections are at risk when blanket bans are issued against religious gatherings. My call is for respect, accommodation, and cooperation, for creative solutions that mitigate the threat of COVID-19 while not cutting people off from an essential part of their lives. In many instances, the lack of such respect has backfired, creating suspicion toward government and the undermining of its legitimate efforts to control the pandemic. Choosing to disrespect religion rather than find ways to safely accommodate it has serious consequences. It infringes on the dignity of believers. It harms numerous personal and communal interests, and it diminishes trust in the important efforts of public health officials. There is a better way. Religion can be a powerful font of legitimacy and practical assistance in a time of crisis. Many religious leaders already have called on their members to make great sacrifices out of deep love and respect for the safety of others. Acknowledging and respecting those sacrifices and seeking for greater cooperation and accommodation is the way forward. Misinformation is a major obstacle in a health crisis. Faith communities can debunk rumors, calm fears, and facilitate accurate information. Many will be fearful of vaccines. Religious leaders can be helpful in the fight against the coronavirus. Respecting the dignity of religious people pays important dividends, but these powerful opportunities and benefits are possible only if officials acknowledge that for believers and their faith communities, religion is essential to their identity and very being. It is my hope and prayer that government officials and faith leaders can collectively respond to COVID-19 in ways that protect both physical and spiritual health. As I now conclude my message, I joyfully do what for me is essential. I express these thoughts and share these hopes in the name of Him whom I serve, whom I love, and whom I represent, even Jesus Christ. Thank you.
Thank you, Elder Bednar, for your very, very compelling remarks about the cohesion of our religious, our faith, and our communities, and for calling on deeper levels of understanding between secular organizations and faith, and deepening those bonds of understanding and partnership and collaboration. Our next speaker is Ms. Nihal Saad, who is the Chief of Cabinet and spokesperson for the High Representative at the United Nations Alliance of Civilizations. Welcome, Ms. Saad.
Thank you very much. Thank you, Ms. Smith. And I would like to also say hello and greetings to all the other distinguished panelists in this panel discussion. And I will just take a cue of what you have all been saying to complement the your input and your approach to COVID-19, particularly from a religious perspective, or focusing more on the role of religious leaders and faith-based organizations. Since the COVID-19 pandemic has laid bare the world's vulnerabilities and divisions, falsehoods, and brutal inequalities, we have been pretty much hearing from all over the world and from world leaders, and here also at the United Nations, we have all been saying that we are all in this together. However, as time passed by in the past few months, we have realized more or less that there is no such thing as we are in the same boat, or that we are all in this together. Theoretically or virtually, perhaps this is the case, but in real life, this is a myth. Or as the UN Secretary General put it a few months ago, that while we are all floating on the same sea, it's clear that some of us are in super yachts while others are clinging to the floating debris. So since this global human crisis took its toll on all of us, the forces of division and hate have been exacerbating the lives of vulnerable communities, including religious and ethnic minorities, migrants, women, children, and youth. Even old people and those with disabilities were not spared. And it's especially appalling to witness a surge in hate speech, xenophobia, anti-Semitism, Islamophobia, Christianophobia, racism, and despicable forms of discrimination. These evil forces sow fissures and holes in the fabric of our societies, triggering a vicious circle of violence. We firmly believe that fragmentation of our societies is perhaps one of the most serious upheavals of COVID-19. It has long-term impact rather than the short-term impact of the health crisis that we are all in now. The social upheaval and the socio-economic upheavals are long-lasting impacts. They are not shortly timed. So, however, there is always a reason to be optimistic as we are facing this pandemic. We have seen that there were a number of resolutions that the United Nations General Assembly adopted since the beginning of this crisis. We have three main GA resolutions: A/74/270, A/74/274, and finally the omnibus resolution that was adopted on the 10th of September. And it is a comprehensive and a coordinated response to the COVID-19 pandemic. So I would like just to give you very briefly what the United Nations have been doing, and then I am going to also speak very briefly about what the United Nations Alliance of Civilizations have been doing in relevance to faith-based organizations and religious leaders. The United Nations system mobilized early and comprehensively. It led on the global health response, provided life-saving humanitarian assistance to the most vulnerable, established instruments for rapid responses to the socio-economic impact, and laid out a broad policy agenda for action on all fronts. It also provided logistics, common services, and operational support to governments and other partners around the world on the front lines of the pandemic as they mounted national responses to the new virus and unprecedented global challenge. It became clear early on that the pandemic was more than a health crisis, and that it's, as I pointed out earlier, the socioeconomic crisis, a humanitarian crisis, a security crisis, and a human rights crisis, as it has affected us as individuals and as families, communities, and societies. The global response, the UN global response, also need to engender a deep reflection on the very structures of societies, both nationally and internationally, and the ways in which countries cooperate for a common good. Coming out of this crisis also will require a whole of a society and a whole of a government and a whole of the world approach driven by compassion and solidarity. The three-point plan or system response at the United Nations could be summarized as follows. One, a large-scale, coordinated, and comprehensive health response guided by the World Health Organization. The second is a wide-ranging effort to safeguard lives and livelihoods by addressing the devastating near-term socio-economic impacts and aspects of the crisis. And the third is a transformative recovery process that leads to a better post-COVID-19 world by addressing underlying fragilities and identifying opportunities for transformative change towards more just, equal, and resilient societies and economies. So at the United Nations, in this context, the United Nations Alliance of Civilization have firmly believed and have always been believing in the role of religious leaders and the faith-based organizations and faith actors in stepping up efforts and being always in the front lines. The vast majority, and I take the cue here from what Elder David Bednar said earlier, that the vast majority of people on earth are members of a spiritual community. And although each has their own traditions and their own convictions, there is a common notion that they share together the commandment commandment to embody the principle of leaving no one behind and the fight for social justice, contributing to mobilize resources and support the hardest to reach. And faith actors, as we have always seen since even when the Ebola broke up in Africa and here in the United States, but particularly in Africa, the faith actors have a track record of being on the front lines when crises hit home. Usually in life-altering crises, when people are desperate and uprooted from their lives, faith has always and often been their anchor and the place they turn to for consolation and hope. Many religious leaders have mobilizing capacity as well as the trust of the communities they serve, but with trust also responsibility too. Religious leaders have the responsibility to promote messages about gender equality, challenging stigma and hate speech, dispelling misinformation and rumors, championing attention to and inclusion of vulnerable populations, including minorities, migrants, refugees, internally displaced persons, indigenous people, prisons, people with disabilities, and members of other marginalized groups by creating supportive environments advocating for their rights and access to diagnosis, treatment, and vaccines, sharing evidence-based accurate information, and publicly standing against statements and acts that encourage violence and human rights violations. So in this context, actually, the United Nations Alliance of Civilization have been broadening its reach out to faith actors and to faith-based organizations and to religious leaders since last March. So we've had a number of initiatives that we launched. For instance, we heeded the call of the UN Secretary General on religious leaders to support the UN actions in addressing the challenges posed by the pandemic through promoting solidarity, unity, and compassion. So the High Representative for the United Nations Alliance of Civilization and the Special Advisor for the Prevention of Genocide issued a joint call for solidarity, unity, and compassion, reaffirming the need to strengthen interfaith and intercultural dialogue, as well as standing up against stigma and polarization. In our capacity as the co-chairs of the Interagency Task Force on Religion and Development, a statement also was issued on the 18th of April by the Interagency Task Force with the endorsement of members comprising the Interagency Task Force and supported by the faith-based organizations who are members of the Multi-Faith Advisory Council. And they advocated with member states and other stakeholders for the global humanitarian response plan for COVID-19. In support of the document of human fraternity, co-signed by His Holiness Pope Francis and His Eminence the Grand Imam of Al-Azhar, Sheikh Ahmed Al-Tayyib, we co-organized and supported the initiative Prayer for Humanity on the 14th of May, and it was spearheaded by His Holiness Pope Francis and His Eminence the Grand Imam of Al-Azhar and the UN Secretary General. Many eminent religious figures, as well as political leaders as well, joined in that initiative. And finally, I just want to conclude that by saying that we also have launched and convened a meeting with more than 40 religious leaders from across the faith spectrum in order to come up with a global plan for action, which is results-oriented. And we are about to launch a number of actions related to that global plan of action. It's going to be launched by the end of this year. Of course, we have the United Nations plan of action to safeguard religious sites, which have been developed by the United Nations Alliance of Civilization, despite the fact that over the past few months, there has been a call for ceasefire but a global peace in general, and a global ceasefire called by the Secretary General. We have seen also attacks on a few religious sites, and we have issued several statements condemning those calls. I would like to leave it there, and I will be happy to take part in the discussion and provide more details. Thank you very much, Kirsten.
Thank you very much, Ms. Saad. That was an excellent presentation, and thank you for outlining the linkages between the UN response and faith with religious and faith actors, and I hope we have some time to come back to that in our discussion. Our next speaker is Rabbi David Saperstein, Director Emeritus of the Religious Action Center of Reformed Judaism and former U.S. Ambassador at Large for International Religious Freedom. Welcome, Rabbi Saperstein.
Well, thank you very much. It's been an interesting presentation so far. Let me just begin with a brief historical note from Jewish history. Too often throughout history, in the face of terror, grief, disruption caused by pandemics and epidemics, those who are afflicted seek to explain why such a catastrophe has befallen their families and communities, to understand causes, to blame someone or something. Populations have often targeted minority groups as a source of illness and suffering, despite the minority groups being ravaged as intensely as the surrounding populations. Often Jewish communities were blamed and targeted when they were found in affected areas. Persecutions, mob attacks, ethnic cleansing, pogroms, and all too rarely did others arise to protect us. So as we see today, minorities disproportionately the victims of the disease. We see political upheavals, communal fears, societal tensions and strife, an increase in hate speech and hate crimes. It resonates deeply with us, and I hope we'll call on the enormous potential of interfaith communities to work together to address this crisis. And this gathering is an important step in that direction. The spirit of Jewish legal rules on these issues, that preference saving life, any law except murder, idolatry, or sexual crimes must be broken to save innocent lives. The commitment of communities to provide health care, the rules of during times of epidemics and pandemics in Jewish law that guaranteed that all would be helped through the healthcare system here, and that medicines could not be made more expensive because they were rarer or needed more. The spirit of these rules speak across the centuries to us. As you've heard from my colleagues, in this COVID-19 crisis, religious communities do play a pivotal role in so many ways, in so many areas of the world, both developed and particularly in developing countries. Religious communities are key players in providing on-the-ground health care. They can be a vital source of reliable healthcare information and effective parties in diffusing false rumors, conspiracy theories, misunderstandings about effective preventive measures, about access to healthcare and medicine, about reliability of proven treatments. And they can certainly will be playing a vital role in exactly such efforts as vaccines become available. And at a time that hundreds of millions worldwide have lost jobs, been put on furloughs, faced pay cuts, the social service arms of religious communities are needed more than ever, yet so overwhelmed that partnerships with government structures to provide the resources religious agencies need is absolutely vital. And that's why it's been so encouraging that the major international medical care relief groups, the World Bank, UNHCR, UNICEF, the Alliance, as you heard, World Health Organizations have reached out to strengthen their cooperation with religious communities. I want to commend Georgetown University's Berkeley Center for Religion, Peace, and World Affairs, and our friend Catherine, who is overseeing this daily bulletin on religion and COVID-19. It has a lot of information on these cooperative endeavors here. And of course, my own life's work, running the public policy advocacy arm of the Reformed Jewish movement in the United States, the largest segment of the American Jewish community, has allowed me to see vividly that within the U.S. and through my international work across the globe, so many major denominations and faith groups are advocating for universal care and addressing this pandemic and ensuring that minorities, which in Europe and North America especially involves people of color, the issue of racism must be addressed both globally and within our countries and everywhere. Indigenous and Aboriginal communities who have too often fallen through the cracks. All of these are disproportionately afflicted and so underserved medically. One other key area, ensuring women are not left of our efforts to address the pandemic and the plans for recovery. This aspect of how we respond to the pandemic needs to be seen through a gender lens. Think about it, the devastating impact on women who so disproportionately serve in frontline jobs, too often exposed with inadequate or no protection. The disproportionate role of women as caregivers in medical and nursing home settings, as well as in their own homes. The increase in domestic violence. The disproportionately high number of girls being forced out of school altogether. And the number of those being forced out of school who, out of the economic desperation of their families, often are forced into child labor or child marriages. The need as we address this epidemic and the recovery to ensure that our economic policies, recovery investments, social capital investments are made in a way as to ensure that women are fully included, which is so strongly associated with community stability and economic improvements, is needed more than ever. Elder Bednar spoke eloquently about the religious freedom issues. There is the balance. Any regulation should respect how essential the religious needs of people are, not only in general, but precisely at a time when illness, death, stress, and despair are prevalent. But saving lives must take precedent, and religious entities should be treated by the same health standards as other essential gatherings. So looking at all the roles that religion can play, which have been discussed by my colleagues, remember this above all. Religious communities are distinctive in being both the most local and the most global way that people organize their lives, their identities, their communities. It makes the religious community a unique ally in efforts that in addressing COVID-19. It's successfully addressing this devastating pandemic. Religious entities can, and I know will, play a vital role if government and civil society recognize and embrace religious communities as the key ally they can be. The G20 can help make that potential a reality. Thank you.
Thank you, Rabbi Saperstein, and for underscoring the local and the global realities of religious actors. I hope we have some time to discuss how that engagement might be strengthened. I'd like to move to our next speaker, who is Ms. Alisa Wahid. She is the founder and the national coordinator of the Gusturian Network of Indonesia and a trained psychologist. Thank you.
I'm really sorry. Thank you. Thank you. So again, thank you for the G20 Interfaith Forum organizers for inviting me to share learnings from our experience, especially in Indonesia. And thank you also for Rabbi Saperstein for opening up the door for me, because I will be talking about the interfaith initiatives in the time of COVID-19 pandemics. Next slide, please. Thank you. As in other disaster, natural or social disasters, faith-based organizations are usually the first responders. This is a unique character brought about by the characteristic of FBOs, or faith-based organizations. The first one is communality. There's always a strong sense of bonding between adherents of the same faith, making it easier to call for solidarity and contributions. The second one is faith-based organizations are value-driven organizations based on basic values of their religions. For example, values of humanity, compassion, collaborations, contributions, etc., are all central values in religions. So when a disaster strikes, a true calling of humanity would just happen, not magically, but because it's the calling from the values of the religions itself. And the third characteristic of faith-based organizations is the close interactions and relationship between the faith leaders and the congregations. And this helps to accelerate consolidated efforts. On the organizational side, faith-based organizations, of course, have massive and systematic structure to ensure services to their followers. It means a massive reach out to the grassroots level, enabling faith-based organizations to reach many unreachable spots in community in a massive disaster like the tsunamis in 2004 in Indonesia, or right now the COVID pandemics. More often than not, there will be also services and programs already established at the grassroots level by faith-based organizations, healthcare services, maternal clinics, all kinds of cooperatives and services are already put in place at the grassroots level. These are all characteristics that brings key features enabling faith-based organizations to swiftly respond an emergency outbreak. This also happened in the COVID-19 pandemics in Indonesia. In Indonesia, faith-based organizations are really, really influential, and we set up an interfaith initiative involving the biggest faith-based organizations in Indonesia, like Muslim organizations like Nahdlatul Ulama with its 80 million members, and Muhammadiyah, the second largest with 20 million members, the Catholic churches, the Christians, even the indigenous societies, indigenous faith communities. We capitalize the characteristics of faith organizations, and from our initiative, we learn several approaches. The first one, interfaith response, help resource raising across faith communities. So we consolidated the resources that we can build up. Interfaith response also make it easier to collect data of the most vulnerable people on the roads. Even government, sometimes they have problems with inaccurate data. But interfaith communities, because they reach out to the grassroots level, they can collect the most accurate data of vulnerable people on the grassroots level. Interfaith response also help to accelerate the gathering of volunteers. It's easier to call for volunteers to serve and deliver basic necessities to these vulnerable families. Interfaith response also helps opening access to private sectors and local governments that only faith-based organizations can do through their followers. And we found that interfaith response can really consolidate programs and services like health, economics, and other programs and services. In effect, next slide, please. In effect of these approaches, the COVID-19 interfaith response sent a strong message of solidarity and hope. We create a container of solidarity across faith and communities. Before, it's harder to get people to come together. But in times of disaster, these people, they just join hands together to address the emergency needs. We consolidate resources, services, and programs, making the outreach bigger than usual. We care for the most vulnerable regardless of social divide. And this is a very strong message of solidarity and hope. And we serve those most marginalized, reaching those most underserved. And by this, we also educate societies that religions unite people. They do not divide. Last slide. I would end with a message from our great leader in Indonesia, President Abdurrahman Wahid, who was also a leader of Nahdlatul Ulama and former president of World Conference on Religion and Peace, and a champion of democracy and interfaith dialogue. He said, "The true role of religion is to awaken human to the fact that he or she is part of the human race and the universe." COVID-19 pandemics have proven that. Thank you.
Thank you, Ms. Wahid, and thank you for giving that example of an interfaith response in terms of consolidating resources, mobilizing connections to private sector through your followers, gathering data, playing effective and efficient roles in responding to this pandemic. And thank you for highlighting that in your presentation. Our final speaker today is going to be Father Augusto Zampini Davies, who's the Adjunct Secretary of the Dicastery for Promoting Integral Human Development of the Holy See. Welcome, Father Augusto.
Thank you very much. Thank you very much for the invitation, and thank you to all the other speakers for the very thought-provoking and wonderful interventions. I will try to say something after all those interventions, but just to start with, well, we are the Pope. When at the beginning of the pandemic, he called us to different departments of the Vatican, and he said, "I want you to prepare the future." And we asked him, "What do you mean?" And he said, "Well, this pandemic is causing not just problems of health and public health systems and hospitals, but it will cause big social problems, as it could cause unemployment. It could cause division. It could exacerbate other crises that are happening, such as the economic and the ecological crisis. So I want you to take this pandemic, this COVID pandemic, as an opportunity to prepare the future, not to prepare for the future, because preparing for the future means that the future is set. We are already destined, and the ones who can, we can only buy save life jackets, and of course the ones who can buy it will survive, and the ones who cannot will die. So he said, no, let's prepare a different future, with novelty, with imagination, with creativity, with the realism that only the gospel or our religious traditions can bring. And choose your partners to do it, and do it quickly, because this is the time to prepare the future. We will emerge from this emergency different. The world will be different after the pandemic. So start preparing that work now. And that's why he created a Vatican COVID-19 Commission that is interdicasterial or interministerial inside the Vatican. And we work with all local churches around the world, listening to what's happening on the ground, providing assistance. We work also with all other governments and international organizations, especially not just in, for example, in vaccine development or vaccine distribution, and also or vaccine research, but also on issues on inequality, unemployment, on issues on dealing with the ecological crisis, on subjects on security, food security. We're working a lot with World Food Program, with that they have just received the Nobel Prize for Peace. We work with the FIO, we work with IFAD, because we are facing also another food crisis due to the coronavirus, etc. And with all the Catholic hospitals around the world, and with non-Catholic organizations on issues on economics especially. So we are working very, very hard since the beginning of the pandemic in a kind of interdisciplinary way. But if you can move to the next slide, what also the Pope has asked us is to say, well, we have discovered that the COVID, as all the previous speakers have pointed out, is a terrible thing. It's horrible. There's a lot of suffering, a lot of anxiety. 1 million people died, millions are infected, everything is disrupted. We don't know what's going on. But sometimes when we are in these situations, we know in the religious tradition, we know that sometimes when we are in a crisis, we need to see further. No? It's a kind of transcendental challenge. And we are trying to visualize that world, that future, with the lens of theological tradition, with interreligious dialogue as well, and with cross-cultural cooperation. Because every culture is incomplete, and this is affecting all cultures. Nobody can deal with a global pandemic individually. We can only get out together. But at the same time, the pandemic has shown the inability of the world to face a common problem together. So the inability to face in common a common problem. So this could be another terrible thing, or could be a unique opportunity, as the Pope is trying to push for it, to once and for all change the things that are not working in the world, to promote a proper future that is more inclusive, more sustainable, and healthier. What does it mean? If we go to the next slide, it means what can religious contribute, or at least what are we trying to do from our contribution? So religions, let's be honest, religions, we could be a source of hostility and even of war, of totalitarianism, of fundamentalism. And this is the time also for a conversion in all our communities, that religion, that religare, to reconnect ourselves with the transcendent, ourselves with all our brothers and sisters, ourselves with a common home, with our common home, the planet, is reconnect what we call with God, with all our fellows, brothers and sisters, and with the creation, with the planet. It cannot be done, this reconnection, this religion cannot be done through hostility, war, extremism. On the contrary, it has to be through all the values that were mentioning before, but I was delighted to listen to Alisa mentioning all these religious values that she put it even beautifully, but the values that we call the values of fraternity, of compassion, also Mr. Al-Abudali was mentioning, the value of compassion, the value of care, the value of social friendship, and cultural enrichment. Cultural enrichment is the culture of encounter and not a culture of war or hostility. This is what religion can do. It doesn't mean that necessarily we will do it, but it means we can work together for this, because it's also helpful for our own conversion. It's not just the world has to change. It's the first thing that I would like to say. The second thing, in the second column, the values that I mentioned, the values are important because one of a bigger virus, I would say, than the corona, And the Pope explains this in his new encyclical, his new letter that is called Fratelli Tutti, all brothers and sisters, is the individualism. And individualism means personal individualism or religious individualism, my own religion, or national individualism, or individualism, like my own company. So individualism is actually a virus that prevents us from flourishing because we are social beings. We are beings in relationship. And individualism necessarily leads to relativism because it's my truth, it's my culture, it's my profit, it's my property, it's my vaccine, it's my cure, and it's my territory. It's actually insane because we think we live in a common home. If we don't have a common solution for the cure, it would be worthless. If we don't share the goods that we have, sooner or later that's not sustainable, etc., etc. So individualism is a virus that religions can help curing, and this is fantastic. We are the best equipped organizations and communities to cure the virus of individualism. Why? Because as many of my previous colleagues have explained, we can, all our religious traditions, we differ in many, many things, but we all agree in one that is very important, apart from the fact that there is God, etc. We all believe in community. Yes, and I'm finishing with it. We all believe in a common space, in a common time. We all believe in something that we experience in the history, so that has a vision for the future. But we can do it through our own identity in dialogue, creating something new, and in order to overcome injustices. And I finish with this. What we can do in this phrase, what we can do now is to bring some novelty, because it's true that we have had pandemics before, but this is a new pandemic. Why? It's not just because it's a new virus, because the pandemic is connected with other crises, social and environmental one. And this hasn't happened before. And we can bring something new in order to have a healthier institutions, healthier communities, healthier people, and a healthier planet. Thank you very much.
Thank you, Father Augusto. I think the panel has demonstrated how the breadth and the depth of what we're facing with COVID and the enormous role that faith and religious actors bring to the response. We've heard about a transformative recovery from Assad. We've talked about interfaith collaboration, the values and the cohesion of our religious communities. Our role in speaking to and acting on behalf and with those who are most vulnerable, as Rabbi Saperstein mentioned, some of the issues facing women. I would like to conclude this panel with one question to all of you. We have seen an increased and heightened interest in engagement with religious actors. And we've heard each of you address various levels of how that is happening, both in practical ways, in values, in transformational ways, and in organizational collaboration, such as Ms. Saad mentioned with the United Nations. What would be one recommendation or something that you would like to say about strengthening that engagement in meaningful ways to deepen that understanding and relationships that Elder Bednar spoke about? So can I just invite, maybe we could start with, would anyone like to start, or I'll invite someone?
Can't hear her.
Yeah, so just if I can invite each of you to make a response to that question. Shall I repeat the question?
Please.
Okay. So basically, what would be one recommendation or some suggestion that you would make that would advance the collaboration of religious engagement in responding to the COVID epidemic with state actors, with secular actors? What would be, we've talked about practical levels of engagement, data gathering, response. We've talked about religious freedom. We've talked about responding to specific needs of vulnerable communities that are being exacerbated in the epidemic, like violence against women. What would be one recommendation or one example that you would want to see happen to really strengthen and advance the role of religion and faith actors in responding to the epidemic? What would be one thing that you would want to see, or that you would like to recommend? Elder Bednar.
I hope this is responsive to your question. I think the Father was very effective in just highlighting the role that religion plays in healing. And when we're talking about a human being, there's so many facets, so many aspects, and we're talking about the whole person. So if there's an appreciation for the totality of a human being in healing, religion plays a primary role in that comprehensive totality of healing. I think that's an awareness. I think that's a principle that's vital for everyone to understand.
Thank you. Father Augusto.
Yes, thank you. Thank you, Christine. Given that this is a G20 interfaith, I would have lots of recommendations, but I would mention two. It's impossible to address a global pandemic without good politics, without good global politics. And given the rise of nationalism, the rise of, I would say that politics, the religions could bring together the voices of people coming together beyond borders, no? Like a human family, like a human fraternity, to have a support for multilateral approaches to a pandemic, because we cannot get out in a single region. This has to be for all. Somebody mentioned that. No, I think our brother from Iraq mentioned it will be useless. The vaccine is ready, and it's for some. So the support of new multilateral approach to a global pandemic could be good, and we show that as a global family, saying religions will support that. But also equally related to this, the G20, I know that is in the agenda, the credit and debt. Extremely indebted countries cannot get out of a pandemic if they have to ask for more credit. So one thing that we could do, we did it before in the 2000s, but we can do it now again, to ask for debt cancellation of very, very poor regions, I would say, so as to put that money in health, into care, into development, because otherwise the world will be more divided than it is. Thank you.
Thank you. Ms. Wahid.
Thank you. Religions have powers. These powers can be used to its own advantage, but also these powers can be used to unite humanity. In Indonesia, we have a teaching by a respected Muslim scholar. It's called the three ukhuwah, or solidarity, three solidarity. A Muslim can only uphold Islam as a blessing to the universe if he also takes care, he or she takes care of three solidarities. Ukhuwah Islamiyah, solidarity between Muslims. Ukhuwah Wataniyah, solidarity between citizens of a country or state. And Ukhuwah Bashariyah, solidarity across humanity. And these pandemics have brought us together in this solidarity of humanity. Religions have the power to serve so many people. have the biggest outreach. If the biggest religions on earth can unite as they do at the grassroots level, then they have a voice to direct the future of the world to the betterment of humanity.
Thank you. Rabbi Saperstein.
So, 40 seconds on each of two. I'm going to use the U.S. as an example. One, structural racism, structural poverty. There is an openness to seeing these structural issues right now that is very rare. In the U.S., that is so extensive with the structural racism questions about the criminal justice system, policing, et cetera. The religious community can really be the lever to help really come to grips with those structural issues. And secondly, if we're ever going to get out of this, it means that there will be a vaccine that will be accepted by large percentages of the human race. And we're doing that at a time where anti-vaccination myths and superstitions are escalating and traveling on social media all across the globe. The religious community can plan for this right now before it happens, to really try to work together about what our role can be in helping to be the source of good information and wise moral guidance to our followers all across the globe. So those are two structural things I think that we're in a vital place to make a difference on.
Thank you. And finally, Ms. Saad, could you conclude with your brief comments to the question?
Yeah, sure. I just wanted to add something to what have been already said about what should be what should be done while we are focusing on the role of faith actors and religious leaders in addressing the challenges of this pandemic. I believe that the key point here is building trust between faith actors, the various faith actors, and relevant stakeholders, whether these are state or non-state actors. Of course, there are many faith actors on the ground, and there are many faith-based organizations already on the ground, and they have been delivering very valuable services. But it's very important also to build that trust. So that we can give them the appropriate and space that they deserve in order to be able to provide the services and help and support their communities. I think also the other point that I wanted to make is, again, referring to the Human Fraternity document that was co-signed by Pope Francis and the Grand Imam of Al-Azhar. This document has been further elaborated in the remarkable document that His Holiness Pope Francis launched last week, the encyclical Fratelli Tutti, and in which he elaborated on many issues, including some of the issues that we're dealing with when it comes to the implementation of the SDGs or the Sustainable Development Goals. I will quote him, and I will take one of his quotes and I will end it there, which is, "We must put human dignity back at the center, and on that pillar build the alternative structures that we need." And I leave it there.
Thank you, Ms. Saad. That was an excellent concluding remark. And thank you to all the panelists. We had quite a number of speakers for the period of time that we had, and I appreciate all of you for respecting the time and for your insights and various contributions to the conversation as we move forward. We will be concluding this session now so that we can move on into the follow-up panel discussions. And thank you to the speakers and to the hosts and to especially Anya Piskar, who helped organize this particular plenary. Thank you.
Thank you so much to the moderator and the speakers of the plenary panel session, especially for those very concrete recommendations that came out at the end of that session there. We'll take a short 15-minute break now, but we'll reconvene for 3 concurrent panel discussions where we'll have the opportunity to delve a little bit deeper into the issues that were discussed at the plenary panel, so we hope you'll join us for that. The first panel discussion is titled Faith Communities in Partnership to Address COVID-19. The second panel discussion is titled Responses to COVID-19 Priorities and Accountability. And the third panel discussion is entitled Supporting Vulnerable Groups in Times of COVID-19. So there will be an opportunity in each of those sessions to ask questions, to pose recommendations and comments. So we hope very much that you will join us after this short 15-minute break. Thank you so much.